At Amolot village, Olwenya parish of Balanga sub-county in a far-flanked Kapelebyong district, lives 40-year-old Sarah Amito, who has been living with a bullet in her body for nearly 20 years. Amito recalls when the Lord's Resistance Army rebels, commanded by ICC-wanted Joseph Kony, attacked their village in 2003. She was 21 years old by then. Although she looks normal, she says she has had to learn to be strong, going through untold amounts of pain.
The bullet went through my sister's stomach and hit me in the thigh. Sometimes I feel a lot of pain, so much that I can't even walk.
With a bullet stuck in her thigh, she remains the breadwinner for her family, including her weak mother and 2 orphans left behind by her late sister. Amito's sister is among the hundreds of war victims buried here at Obalanga.
This is Obalanga mass grave, where 365 victims of the Lord's Resistance Army massacre were buried. Amito lives not far away from here, and she only survived by a whisker. Otherwise, she would be one of them.
I feel bad each time I pass by that mass grave. It brings back the memories of my sister. She is one of the people lying there.
Her condition, she says, has deprived her of a chance to get married, as she is being looked at as a disabled.
Here in Teso, there is no man who is going to marry you, especially if you have a bullet wound like me. I don't think I'll get married. If I get well, I'll have to go back and take care of my people.
However, she was happy to be one of the many people in Teso region to benefit from an International Criminal Court-funded surgical camp run by Right International Uganda and Soroti Regional Referral Hospital to carry out their surgical corrections.
The camp is very important to us because we have been having a series of cases coming to the hospital from our catchment population. These specialists cannot easily reach to all these districts to attend to these people from wherever they are, for 2 reasons. The main one being that these regions, these districts, some of them don't have hospitals.
The operations involved the removal of retained bullets, reconstructive surgeries, excision, and general surgeries, among others, all as a result of the war. Some, like Stephen Eyoku, who were ferried from various districts to Soroti Regional Referral Hospital, were overjoyed after the treatment. Eyoku had a bullet fragment successfully removed from his upper arm.
I'm now going back to my gardening, feeling well. I am grateful.
I have for long been praying for well wishers to come and save me. I'm now extremely happy.
I feel much better now. My only request is that the hospital should give us enough medication because our hospitals lack medicines.
The country director, Right International, Sam Tukeyo-Julo, says their work of tackling these problems is a drop in the ocean as the demand is high in the greater north.
So what we have done here is not comprehensive. There are still many people at the community that require those kind of reconstructive surgeries, those that went through the negative side of the LRA war, including a psychological up to now. So we are calling upon other partners to look at that as one of the areas, continue investing if we have to lift the community.
Tukey called on government to establish deliberate interventions for this war-torn region where poverty bites to the bone marrow.
We look at the communities reconstructing after a long civil war. There are also livelihood needs.
Government must indeed get down, provide some capital, provide opportunities for people to borrow. Not necessarily in groups, but even at individual level, it's possible. Give a family 2 million, it can help. Because most people are now suffering. They are not able to send children to school.
For Sarah Amito, it was not a good ending. Her hopes crashed the moment the first X-ray scan results came out. The bullet entered deep into her bone. Removing it is likely to cause a fracture.
It's better to leave sleeping dogs to lie. That's what we're going to do here. We are basically going to do counseling, really telling her she can live with this kind of foreign body for the rest of her life.
She couldn't hold back her tears over thoughts of what she was returning home to. She came hoping the bullet would be removed for her to be able to fight the biting poverty in her home with some ease. Nothing I can do now, I know. I have to go and persevere, she said. That for the rest of her life. Edward Muhumza, NTV.